right, welcome to Tech Talk with AFO. Tech Talk with AFO is a program I started early this year to focus on technology, conversations around technology. But the one we're doing now is a special edition that is primarily to spotlight tech actors, people that are doing wonders in the tech space, which Dr. Funmi, you are also one of those that is worthy of celebration. A round of applause for Dr. Funmi. A round of applause for you now. And clap for yourself. You need to appreciate yourself.
Thank you.
Celebrate yourself. We will celebrate you. AFO is also celebrating you anyway, right?
Thank you.
I want to quickly introduce someone to you very quickly. I want to see if it's someone that is familiar to you. Let me share my screen.
Surprise. Okay. I don't remember where this picture was taken.
This week, I'm thrilled to spotlight Dr. Funmi Adewara, a visionary physician and digital health executive whose groundbreaking work is transforming healthcare across Africa. As the founder and CEO of Mobihealth International, Dr. Adewara leads a pioneering telehealth company dedicated to bridging the gap in access to affordable primary health care in underserved communities. Mobihealth addresses critical challenges such as healthcare workforce shortages, infrastructure deficits, lack of healthcare insurance, medical tourism, exposure to counterfeit medicines, unqualified personnel, and high treatment costs.
Our platform essentially is tackling the massive brain drain and shortage of doctors across the continent. It's an integrated telehealth platform that allows anyone in Africa to connect with doctors anywhere in the world. And that enables them to get access to genuine medication, prescription, diagnostic tests, and other preventative resources. And so it's been an exciting time, especially post-COVID. Thanks to COVID-19 pandemic, people are now warming up to telemedicine, which just means using modern day technology to provide clinical care to patients remotely, especially those in rural, hard-to-reach areas.
With over a decade of clinical experience in the NHS UK and a stint in the pharmaceutical industry as a drug safety physician, Dr. Adewara's expertise spans both clinical practice and the development of medical product devices and diagnostics. She is a respected member of the American Telemedicine Association and has been recognized with numerous awards, including the Forbes Technology and Innovation Award 2023 and the World Bank SDG Global Award 2020. Mobihealth offers a comprehensive range of telehealth services, which includes teleconsultations, remote diagnostics, telekiosk, and mobile health units. Since its public rollout in 2020, Mobihealth has seen remarkable growth. The subscriber base in Nigeria alone grew from less than 4,000 to over 34,000 subscribers between 2020 and 2021, with revenue jumping from $83,500 to $814,400 within the same period. The company plans to capture 10% of the market by 2033, as validated by a visibility study conducted by the Boston Consulting Group. Mobihealth has secured significant funding to support its initiatives. This includes a $1 million grant from the U.S. Trade and Development Agency for a visibility study aimed at expanding its telehealth service across multiple African countries, and a $1.5 million investment from Afrexim Bank. Additionally, partnerships with organizations like Union Bank of Nigeria and the Bill and Melinda Gates Foundation have furthered its mission to deliver healthcare to underserved population. Join me in celebrating Dr. Funmi Adewara for our relentless dedication for advancing healthcare through technology and for our inspiring contributions to the global health community. All this indeed makes Dr. Funmi Adewara a tech actor worthy of celebration.
To be honest with you, going through your profile, I'm super impressed. And I'll tell you for two reasons. Two reasons because I remember, when we were shopping for an health insurance for my two organizations, it was actually a major issue. We were using one particular health insurance provider, and the experience wasn't just good at all. It's always one problem or the other from my team, particularly when it comes to getting prompt response at the different hospitals when they visit. There's always this, for some weird reason, HMO providers in Nigeria, when you get to hospitals have this competition going on between them and the HMO. They prefer you to be their customers directly as against whatever relationship they have with it. So it was really so annoying. Then we got introduced to Reliance. Reliance, this is free publicity for you, right? We got introduced to Reliance, and Reliance had something similar to what Mobihealth is doing, which makes their own service exceptional for us. You're engaging there's a doctor available for you on their mobile app that you can engage, and that was an awesome experience. You need to just, we took our time to ask everybody in the office, what's the service like now? Because a lot of people they needed attention on the basis of what they are feeling immediately. And these are issues that could be resolved immediately, delivery of the medicine. So going through what you guys are doing and how far you've gone, I'm sure you'll share with us the latest on what you achieved. But I thought I should quickly emphasize, what really got me fascinated about what you're doing. But anyways, our conversation today is about Dr. Funmi, is about Mobihealth. And the first thing I would like you to start with, which combines your opening remark, is for you to walk us through your journey. Who is Dr. Adewara? Your professional journey, how it all started, right? And give us a bit of your background.
Well, thank you so much, Mr. Falabi, for having me. It's such a privilege and an honor I don't take for granted. And distinguished audience, it's my pleasure to meet you all. Yes, my name is Funmi Adewara, and I'm a physician by training. And I was born in Nigeria, in northern Nigeria. I grew up in a household of 5. I'm the 4th child, and I have a very pleasant memory of my childhood. So I grew up a very studious, focused child, and I think that endeared me to many of my aunts and uncles. So I was surrounded by very resourceful women. So if I look back at my journey, I think that has inspired my entrepreneurship journey so far. My mom was a businesswoman and worked in the AB teaching hospital. So I used to go with her to hospital a lot of times. That inspired me to study medicine because I saw firsthand the sufferings of people who needed healthcare and were in a very vulnerable state. They were slumped on benches, waiting on a very long queue to be seen by doctors and nurses who were usually very overwhelmed. So that inspired me in a way to study medicine, because at that time, I was a frequent visitor to the hospital, having had my own health problems. I suffered an injury that needed a lot of surgeries. So from a very young age, I was constantly in the hospital. I was on admission. So during the night, sometimes I will hear the wailings of mothers and families who have lost their loved ones, and most of the times to preventable illnesses. And growing in that hospital environment, that kind of spurred me to want to help, So that was what really inspired me to study medicine. And I studied in the University of Ibadan, Nigeria. So I graduated top 1% of my class. I had always had interest in public health. So during my community postings, we went to Igbora. You will see people who didn't have the resources to buy healthcare plans. They don't know what health insurance is. And many of them were just living with chronic diseases, hypertension, diabetes, without knowing it and what to do. So I had always been very passionate about driving healthcare to underserved communities. I served as the treasurer of the University of Ibadan Medical Student Association during my year, and also was the vice chairman of the Action Group on Adolescent Health, which was a youth advocacy group that looked after the reproductive health of young people. When I finished my graduation, I then proceeded to do my housemanship at Abuja. That's the National Hospital in Abuja, and then went on to do my youth service. I served at the National Assembly Clinic. During my youth service, I was elected the chief medical director of my camp clinic for the National NYC. Yeah. So I was responsible for coordinating the setup of the camp clinic for my batch B NYC group. And we catered for over 300 youth corps members then. After which I then proceeded to England, because like what is happening today, many of doctors, 90% of doctors that you interview are on their way out. So when we finish, the first thing on your mind is you want to write PLAB exam, USMLE, you just want to get out of the country because you want better quality of postgraduate training, you want better quality of life and better earning opportunities. So I left for England, and I worked in the NHS for a few years, for close to a decade. But during that period, I was also doing some other things, including energy business. And because of my versatile background, I love entrepreneurship. I was looking for something a bit more challenging. And so I also worked at as a drug safety physician with Mundi Pharma, one of the leading biotech companies. And we were responsible for safety surveillance for medicines. So you see those leaflets that you see in medicines. Yeah, so I was part of the medical team that would then look after that. So we're the ones that decide because from the outcome of clinical trials, whether this drug was safe in a pregnant woman, whether it was safe in somebody with heart disease or not. So it was a very pleasant experience for me. But when I was back there, I used to get a lot of calls from back home in Nigeria, asking for second opinion, asking for you to vet some certain kind of treatment. And I was doing that over the phone. I'll connect patients in Nigeria to doctors in London, in the US. So I started to research and find what could I do differently? How can I scale this solution? So I didn't want to do public health, which was very common for my colleagues then to want to do MPH as their masters. I wanted something a bit more versatile. So I researched and I found that Cambridge University did something that was called Bioscience Enterprise, and it had to do with bringing scientific innovation, biotechnology, scientific innovation to scale. So I did my master's in Bioscience Enterprise from Cambridge University, and that kind of springboarded me into the journey of Mobihealth. So for me, Mobihealth is a very personal journey. I would say it's my passion really blending with my purpose in life. My purpose is to be able to support and to help people who are vulnerable to attain quality healthcare, to attain quality of life. And my passion is entrepreneurship because I'm solution driven. I love to find solutions around problems. And so I think, yeah, that's what I would say in a nutshell is who I am.
It's loaded. Now, it's loaded. I'm going to take it from something you said that was actually that stands out. Like you already know what your purpose is in life, which quite a number of youth struggle with, right? And that's really something, we must all take very seriously. To discover yourself, to know who you are and what you are best at doing. It helps a lot to really set your future for you. There was also something you said, which I kind of have a different perspective about it now. That every doctor you talk to, 90% of them want a out, okay? And during COVID, just for you to know how furious I was with UK government, I did a petition. I wrote to the Prime Minister, I wrote to the embassy, furious about the fact that nobody was talking about it. UK had a policy to attract Nigerian doctors. It's a case of David going after the only wife of one of his disciples simply because he just needed another wife when he has God knows how many tens of wives about that time. Like UK with a whole number of doctors trying to get doctors from Nigeria. I was so mad about it and I did a petition. But using you as an example, any doctor that is going out of Nigeria for whatever reason will still come back.
Well,
And because for some reason you guys still have that Nigeria in your mind. If Dr. Adewara didn't have the exposure you have, the experience you have, we probably would not even have Mobihealth. I have a cousin too, who is also a surgeon. You're probably familiar with him. Dr. Nino Lowo is a surgeon. He's trained in US. He comes regularly through services like yours to perform surgery in Nigeria. He actually has a dedicated number of hours and days on a yearly basis to come for surgery. Not for anything, but simply because he wants to serve. And I see that as part of what you're also doing. What is driving you is not, because you want to make money out of it or what have you, is because you understand how much we need this. And again, which speaks to what is driving Tech Talk with AFO. There was a report from UNICEF a couple of weeks ago, and I'm sure this would also surprise you. It will shock you to know that in Nigeria, just 7% of Nigerian youth between the age of 15 and 25 have access to ICT. Can you believe that? 7%. No, one would assume that, okay, with computer system everywhere and all of that, we should have a good, technology penetration, but unfortunately, that's not the case, just 7%. And that's what is driving some of the things I'm doing. What you guys call end of life in UK, computer systems that are not useful to you end of life is the beginning of life for us in Nigeria. And what I've committed myself to doing, and we've really made good progress with that, all those used computers, just give it to me. I have youth in Africa that would change their life in a significant way. So that takes us to you. You have actually touched the second question. I was going to ask about your academic journey from Ibadan to Cambridge, but you already covered that. So that will take me to my third question, which I hope you're prepared for. I asked all my guests about it. We can't have Dr. Funmi, you just mentioned how intellectually savvy Dr. Funmi is. Why can't we have people like you in politics to make a difference, right? We need to, governance, if you really want to fix Nigeria, is also from addressing governance. So we need more of you in politics. Why, are you not considering becoming a senator that would sponsor bills that would really turn things around?
Well, thank you very much for that compliment, I would say. But I believe that as individuals, we can make differences we can't all be politicians. We can't all be governors. We can't all be presidents. I think what's important is that we all recognize our purpose, as I mentioned, and and find ourselves doing what we want to do the best way, but also supporting the government in driving policy formulation and implementation. I think that's where my strength is. So when I started Mobihealth, I recognized that there were quite a lot of gaps that needed to be filled for digital innovations to really get to the last mile, especially in healthcare. Healthcare has a lot of problems. It's a multi, we needed a multidisciplinary, multi-pronged approach to addressing the multiple challenges that we face, from infrastructure deficit to the lack of funding to the poor remuneration structure for doctors and nurses that is driving them out. So we have push and pull factors that is driving doctors out. It's just beyond asking somebody to be patriotic. It's beyond that. There are push and pull factors that, if they are not addressed, we'll continue to see a massive exodus of doctors. And no matter how many of doctors and nurses that we train, if we don't address those fundamental issues, we will be training them for export. And I just wanted to also quickly make a remark to what you said about UK attracting doctors. Well, that's the law of supply and demand, right? So the doctors will go to where, a UK doctor is paid 10 times what a Nigerian doctor is paid, right, for the same skill set. So these are the factors that are driving doctors out. Then you then have insecurity. You then have the need for a more quality postgraduate training in line with best global medical practices. So I want to say that from my interaction with colleagues like mine, they are very passionate and they want to come back home. They want to give back. You know, there are quite a number of people that are doing medical tourism, a medical mission in Nigeria. But staying back is a totally different ballgame. Some of us have taken the risk. We want to come back. We believe in Nigeria. We believe in the opportunities in Nigeria, and we want to be part of fixing the solution. But I don't have to be in politics to do that. So on my own part, I'm able to address to advise. So I advise the Africa Development Bank. I've been part of external reviewer for policy formulation during COVID pandemic. I also provide some input in terms of policy formulation to government here, to MDCN. I work with closely with the Office of the Registrar to try and give support. We've also written also to the Federal Ministry of Health on some of policy changes. I'm part of HFN, the Healthcare Federation of Nigeria, and these are fantastic groups that have put in policies together to help to support the government. I believe doing that is more impactful than just being a minister or a commissioner for health. I think people who are better skilled at that are already doing the job.
I agree with you to an extent, but we also cannot take away the fact that being on an advisory role might not necessarily be good enough, particularly if those at the other side of the divide really don't have the type of exposure and experience you have. Your recommendation, your advice could end up some wardrobe somewhere. And for reasons best known to them, it won't get them the implementation. You also need people that would really have the tenacity and drive to make a difference. Anyways, I just thought I should drop that.
I believe that we have a very good,
applicable to me, but I like to talk about it.
I would say that I have confidence in the current leadership at the Ministry of Health, from Professor Pate and Dr. Tuji Alausa. I believe that these are people who are very passionate, they are very experienced, very exposed, and they mean what they say. So I think with the right support, we will begin to see changes that we need in the health sector. It's not going to be a magic wand, but I think we have the right people at the right helm of affair now.
Time will tell. Anyways, so introducing a new concept like telemedicine in a country can be challenging. I'm sure you'd agree with me, particularly in a complex healthcare environment like Nigeria. So my question is this: what were the initial challenges you were faced with promoting a telemedicine service in Nigeria? I mean, you're asking people to pick up their phone and engage a doctor. There's this, what's it called, personal engagement, you know. I don't know how this works. There's this psychological healing that happens when you are seated with a doctor. Like, I mean, whatever that is wrong with you, just want to have that conversation with a doctor. How would telemedicine bridge that, or what has been the experience like?
So thank you very much. That's a very valid question. When I started telemedicine, when I started Mobihealth, November 2017, I was providing this service pro bono, providing health education online and the rest of it, and trying to build a solution that was really, that was fit for the Nigerian and African community, because we couldn't do a cut and paste solution from the West. There were quite a lot of differences. And I think one of the challenges was the fact that, like you said, it was difficult to sell. Telemedicine wasn't new. It has been in existence for more than 2 decades in the US. You have American Well, you have Teledoc, very profitable, very successful telemedicine companies. And in Africa, we've had different silos of telemedicine initiatives that probably just didn't see the light of the day. What's different now is the fact that we have digital revolution and a massive, explosive mobile technology adoption. We have over 500 million mobile subscribers across the continent right now, who are on, and about 30% of them are on smartphone, 3G, 4G network. So these bodes well for the adoption of telemedicine. We've seen the transformational changes through sectors like aviation, banking and finance, where people don't necessarily need to go to the bank before they do their banking services. transfer money, book your flight. How much more with healthcare? But of course, this is going to ride on some basic infrastructure. So if a user does not have power supply, how would they charge their phone? Where would they charge their computer and even connect with you online? So that was one of the major challenges, especially for rural areas. So we quickly knew that we had to work our way around some of the difficulties we had. So I would say in terms of infrastructure challenges, lack of power supply, road network is poor. So if you had to see a patient and you have to transfer them after you have seen them on telemedicine for whatever reason to the next level of care, then of course that's a challenge. Insecurities, it was a challenge. But for us, mostly internet and power supply were the most challenging. The quality of the internet services and the cost of internet. We didn't want a situation where we bring a solution and the cost of data is competing with the cost of healthcare. And Nigerians, Africans currently pay 6 times what they pay in the West for data. So we had to create a solution that was viable. And what we did was make sure that our telemedicine clinic, which is a hybrid model, we have the users can access our portal through mobile phones, through computers, and they can go into a walk-in clinic. You know, a walk-in clinic comes with solar power, internet connection, a medicine dispensary for essential medicines, and rapid test kit. With this, we can solve more than 60% of the problems. Most of the rural areas, that 70% of the population, they live in rural hard-to-reach areas, and they have no access to healthcare, no access to the internet, no access to smartphones. They can't afford it. They have multiple comorbidities. How do we reach these underserved communities? So we created the telemedicine clinic as a hybrid model so that even if you don't have a smartphone, you can simply walk into that telemedicine clinic and there will be somebody there who helps you to connect on the screen to a doctor who may be in another state or outside the country. So that's the most impactful, I'll say, of our model in terms of being able to reach that 70% population that do not have access. So in terms of the challenges, you have the infrastructure deficit, whether it is power, whether it is digital infrastructure, and then you have cultural adaptability, like you have said. How are they going to accept this? I remember the early days, even when I asked how many people have experienced telemedicine, there were usually fewer than less than 5%, less than 1% of the room. But now, post-COVID, we have seen a massive jump in knowledge, in sensitization, and in willingness to adopt telemedicine. So we have seen over 500% increase in Nigeria alone in the adoption of telemedicine. People are now more aware. Remember during COVID, hospitals were shut because of the fear of infection. People who had chronic diseases could not access their doctors. They couldn't get their medicines. We had people who had stroke during COVID, and because of telemedicine, we're able to help to save their lives. We had people who had diabetes that could not get their medicines, but because of telemedicine, we're able to mobilize from one part of this country to another to get them their medicines and to also get them remote monitoring and management. So that's the power of telemedicine. I think people began to see the impact of it. Doctors began to say, okay, yes, I can provide this care. Because you see, there are different levels of resistance that you see. From the user perspective, the patient, and then from the provider perspective, the doctors. Because COVID just happened on us, right? And many people were not taught. It's not in the medical curriculum. Telemedicine was not built into the medical school curriculum. So it just happened on us. So doctors were a bit hesitant because we're very resistant to change, by the way, doctors. So we're already so busy, and then you bring in a new technology. I don't even know how I'm going to assess this patient. What's the limit of my professional liability? What if I get the diagnosis wrong? How am I going to check the patient if I can't listen to their heart? I can't see their lung. I can't listen to their lungs. I can't check the child's ears. And how am I going to make those diagnoses? So it took a lot of enlightening campaigns, a lot of sensitization, a lot of training to get them to use it. And the fact that it's been in existence before, and we had reports to back up the importance and the value and the valid and the benefits of validity and the benefits of telemedicine. I think that kind of helped. But we're still a very long way from where we need to be. There's need for cohesive digital health policy around telemedicine. I think telemedicine needs to be a national strategy whereby if we have to drive frontier technologies like this to the last mile, the government needs to come on board. And with the government on board, you are able to instill confidence in the users that this platform is safe, that you can use it. You don't need to rush to the hospital every time you're sick. 60% of your problems can be solved through telemedicine.
So looking at where you are today and the future you are looking at, because I know quite a number of investments have just happened, and of course you are also in the middle of raising more capital. Right? But to look at where you are today, we're talking about how many subscribers, that you have on your platform, people that have used your service, how many kiosks do you have in place across Nigeria and beyond? And how many of these clinics do you have operational, just to have a sense of the type of your penetration as of today?
So we haven't even started to scratch the surface at all. Nigeria has 200 million people, more than 200 million people. 95% of them don't have access to basic healthcare. So it's a very, very big market. Nigeria is our first entry market, even though we're registered in the UK, we're registered in Nigeria. In the UK, we provided testing services during COVID, but we're not providing telemedicine services yet in the UK. But Nigeria is our main market because when we started off, it was our focus. We wanted to make an impact because that was where the need was greatest. And I remember during the first few years, the first year we went commercial January 2020. We had about 1,000 to 1,500 subscriptions. Then we went and we partnered with a government agency and then corporate organizations. Then we went to 5,000 subscriptions that covered 6 lives. And then we doubled that the next year to 11,000 subscriptions that covered again 6 lives. And then we went on to close to 30,000 by the third, fourth year. So right now, we're looking at reaching about 100,000 people yearly by 2033, reaching about 1 million. That was our projection. But when BCG came on board, when we got that funding from the US government, BCG did a feasibility study and saw that Mobihealth can actually impact 5 to 10 million lives by 2033 in telemedicine space alone. And that's very achievable. If you look at it, if we go state by state, you have each state is over 1 million. Yeah, do you understand? Lagos State alone is about 23, 24 million people. So if each of those states, even if we get 100,000 per state, getting 10 states alone gives you 1 million subscription already. Do you understand? So it's very possible, it's very achievable. Our model is focusing mainly on the mass market, where users pay only 5,000 naira a year to access doctors locally. And then we have the premium services, which targets the high net worth individuals, those who go on medical tourism, diasporas who already spend about $2.5 billion every year paying medical bills of their families back home. Those are our core target market for the premium services. And those ones pay a premium that enables their families or themselves or their loved ones to connect with doctors in the US, in the UK at a premium cost. But at that price, it is still about 70% less than what they would have paid directly if they were consulting with those doctors. So we have a very viable business model that has been tested by the Boston Consulting Group. The risk analysis around technical, market risk, go-to-market strategy, all have been carefully investigated, and we're very, very much happy with the results. So our plan is to implement along those lines.
Oh, okay. So there's something that just came to my mind, and I don't know how applicable this would be. If you remember back in the days when ATM was introduced to Nigerian market, banks were given approval to install ATM machines outside bank and in some commercial areas, right? And I think the last dispensation gave license to something that is cost effective, but seems to have, massive penetration compared to putting ATM, and these are the POS terminals, POS terminal agents, right? Now, if you look at the number of POS terminals that you have across, looking at the peculiarity of Nigerian market, right? You can get it anywhere, any rural village, and that's got me interested in the kiosk model that you adopted. I really want you to really explain how that works, because if you have health partners operating a small kiosk like you've described, solar panel with internet service provided. You have all the basic amenities for the purpose of running some tests, right? And you have agents that are either medical assistants, I don't know what type of qualification that will be required. You know, it means that you actually can exponentially grow your penetration,
That's
you know,
right.
even beyond what you have now. So I really want you to explain that kiosk model and to talk about where you have it operational.
So yes, you're very much on point. And well, if I'm saying this, you're going to be arming my competitors to copy my model. But anyway, well, so yes, you're right. We wanted a solution back in November 2020. We got a grant from the Bill and Melinda Gates Foundation, and it was one of our big achievements. And it's incredible how far we've come now. But yeah, that $200,000 was to demonstrate that our solution could actually reach the poor, the rural hard-to-reach communities, and to be able to deliver primary healthcare. Because if you solve primary healthcare, you have solved a fundamental 80% of the problems. And primary healthcare is where you go the first. That should be your first point of call when you're sick. If we can, most people defer and default to secondary and tertiary centers because there are no doctors. They don't have confidence in the primary health centers. Most of them are dilapidated and there are no equipment and the right facilities there. So we had to pilot to show that telemedicine can actually improve the primary healthcare delivery in rural communities. So Gates Foundation gave us a grant and we went and we piloted in 3 local government areas in Nigeria, in Ekpe, in Lagos State, and it's still running. We have it in Bichi, in Kano State. We had it in Kaduna, in Kagoro. And the result was remarkable. It showed that telemedicine can improve access to healthcare more than 80%, whether it is reproductive healthcare, mental healthcare, maternal and child health, immunization, everything, the 5 pillars of primary healthcare can be delivered through telemedicine. In Ekpe, I remember when we started, the women there said that they thought that we were jokers, that Telemundo, it won't work. And that they're pleasantly surprised because people now, that telemedicine has actually increased patronage of the facility. And most people will come in and say, I'm going to see my doctor inside telemedicine room. They will just collect their card and go there. And that even the expatriates working in the Ekpe community come to the PHC because of Mobihealth, because they see that there's a doctor that is going to be there to see them. Also, the fact that the PHC staff have the confidence that if they need to escalate a patient, they're not just going to be treating a patient blindly. If I'm seeing a patient and I'm treating them for malaria or any diarrhea disease or anything, and I think that this is complicated, I can instantly escalate that patient to a doctor on the screen through telemedicine. So and we're working in sync with the doctors and the medical service providers on site. So once a patient has been seen, their prescription is sent to the pharmacy, they go and collect their pharmacy, and if it's a diagnostic test, it will be done there. Now, for the telemedicine kiosk and mobile clinics, that's a different model. That one, our intention is to roll out hundreds of them across the country. We want telemedicine to be as accessible, healthcare to be as accessible as within a mile distance you travel, you see telemedicine. We work with existing infrastructures like banks, malls, schools, marketplaces, estate agents, or real estate, and several communities, pharmacies, diagnostic centers. We just put telemedicine clinic there. And when you go in there, you have somebody there. You don't need to have a digital skill. You have somebody there who then helps you to register, connects you straight on with a doctor. Importantly, we have point of care diagnostics, like the point of care ultrasound. You don't need to go all the way to go and do an echo scan to get the result of your heart scan or abdominal scan, or even to scan a pregnant woman and be able to make quick intervention. Our point of care ultrasound is a very simple device, is FDA approved, is AI driven, and you can scan the heart, you can scan the lungs, you can scan the abdomen, you can scan a pregnant woman, and the doctor can be anywhere in the world seeing the result in real time. We also have the point of care diagnostic test kit that enables a doctor to listen to the heart, to check the ears of the child, all the vital signs. So in the early days of telemedicine, one of the barriers to adoption was the lack of physical examination. Now, technology is helping to solve that, and it's enhancing the quality of care that patients can get and physicians can make through telemedicine. So our intention is to roll out hundreds of these telehealth clinics, and the funding we've got will help us to achieve that. We're already in partnership with banks and health insurance companies, and we're going to partnership with one of the second largest telco company, or one of the largest telco company in Nigeria. Through that, those partnerships, we are confident that we'll be able to impact and scale our solutions across the country and beyond.
I know without doubt in my mind that, and with someone like you in the driver's seat, I mean, all of these things obviously would be achieved very quickly. So today you have how many doctors that you are, working with on your platform, both locally and international?
Oh, well, we have thousands of doctors. Our intention is to build a very big global database of doctors across all specializations. We've trained thousands of doctors. We work with the Medical Women Association of Nigeria. We work with several other groups. We work with MANSAG. We are also looking at, of course, other medical associations across the US, Canada, and the rest of it. We have thousands of diasporas. Nigerians in the diaspora, the doctors are over 50,000. Doctors scattered all over the world. And then you think about other African doctors. So our intention is to bring as many of them as possible on the portal across all specialization. Many of them work for us on a freelance basis. So they are in control of their time. So you may not see them all the time on the portal, and it may be that you just need to refer a patient to them. Then there are some that are constantly there on the portal. So we have a different model for that. But yes, it's demand driven. As the demand increases, you're able to get as many more to create appointment. Some may create 1 hour, and in that 1 hour, you're able to see 3 patients, because each appointment is about 20 minutes. And then you're able to see 3 patients. Or you could have availability for the rest of the week, every 1 hour, every day, or 2 hours. So they have their regular jobs, but they also provide the telemedicine services on our portal. And then the local doctors are also here. So they work together with the foreign doctors, and they coordinate the care of the patient end to end. If there's a need for a patient to be transferred to the hospital because it's beyond the scope of telemedicine, we also have partnerships with hospitals where we could refer to a specialist locally to see the patient. We work with labs, we work with pharmacy, so that we can provide an end-to-end integrated model of care to the patient.
I see a problem here already, and I don't know how you're handling this. Health is kind of personal, right? I've had a doctor that has been my doctor for a long time, okay? And looking at what you described, I'm engaging this doctor on your portal now. I mean, how does it work in terms of managing my history and ensuring that the same doctor is the same person that is relating with me, beyond the fourth engagement?
Absolutely. So the platform is very, very flexible, and it allows you to choose your doctor. So you could choose your doctor, and the doctor can choose his patient and have his cohort of patients. It's very flexible, but there are times that you also need to see a specialist. So it's not an all-round doctor who knows everything. You may need a cardiologist review today. You may need a neurologist review tomorrow. So the doctor you can choose your primary care physician. And then if there's a need for him to refer you, or you prefer to see for a second opinion, then you have the opportunity and flexibility to do that. I think that's what the platform enables.
Oh, awesome. So correct me if I'm wrong. What you're doing is what can be likened to what Doctor Without Borders are doing, but right now you are really bringing it down to the community, as against, to set up somewhere and patients are brought to you for operation. In your own case, I look at that, your mobile concept, like you have a mobile truck that is moving from market to market, town to town, to offer these services. That seems unique. You want to talk about that a bit?
So our model, let me just say, our platform is accessible online to anybody in Nigeria through apps.mobihealthinternational.com. You can access the service 24/7 on your mobile device or on your computer, iPad, from any part of the country. And if you needed to see a doctor, you log in, you buy a subscription plan, 5,000 naira a year for up to a family of 6, and then you request an appointment. You can request an appointment. It will populate with the doctors that are available. You look at their profile. You can put your doctor's name on it and choose that specific doctor again for continuity of care, if that's your preference. And then you book an appointment. The doctors already provided their availability. So you will see maybe Dr. John is available 9:30 a.m., 10 a.m., 12 p.m. And you can choose the time that is convenient for you. You will see the doctor's profile as well. You will see the reviews of the doctors. So you can choose whichever doctor you prefer. And then once it's time for consultation, you join the room, the doctor establishes like this contact with you, and then he does what he does. Because we're not training the doctors on what to do. They're already trained. We're just providing them the platform to be able to reach more people. And then once he's done with during his consultation, of course, our platform is an electronic medical record. So it has your past medical history, medication history, allergy history. It's very important because you don't want to see a patient in isolation and not know what their past medical history is. And that's one very significant difference with our platform. We're not just saying, call a doctor randomly. We have a platform where your medical record is housed and is accessible to you 24/7, accessible to the doctor. So during the consultation, he's able to see your medical report, he's able to go back in and check your past tests and all the rest. And he's able to also do the examination within the scope that I defined earlier. And then he's able to send the prescription to the pharmacy. You can pick it up or it can be delivered to you at home. Through our partnership with other pharmacies, we're able to deliver medicine at a fraction of what they get it from the other pharmacies, retail pharmacies. So they're able to get it at a discounted rate, maybe about 10, 20, 30% off from that, especially for those who have repeat prescriptions. And if there's a need for tests, the same thing, we send the request to the lab. You can go in at the appointed time and have your test done. The result is uploaded to the portal. Doctor is aware of it. He reviews it with you. Or in instances where the test can be carried out at home or your place of preference, the technician can be sent to you to take your blood or to do a digital x-ray, for instance. Now, the other part is the mobile clinics. The mobile clinics are a complementary service to our online or the mobile phones and the computers, because we realize that that segment, 70% do not have access. So the mobile clinics they can come in as in a fixed modular clinic, or they can be in a mobile van. The mobile vans versions are those that somebody tells us, please, we want to partner with you. We want you to go and deliver some health screening or outreaches in this place. And then we go with the van and we'll do that. We could do cancer screening also through that platform, do chronic disease screening, breast cancer screening, and the rest of it. If we also have the modular version where it's in a fixed facility, like the primary healthcare centers I mentioned, or the schools, or hotels, or in pharmacies, you just give us a room there, a corner, we set up telemedicine clinic there. And if somebody comes in, instead of just going on self-medication, the pharmacist could say, okay, have you consulted with the doctor? There's a telemedicine portal there. You can really get quality consultation there so that you're doing the right thing. Or you could put it in a school. In schools where there are no nurses, no doctors, all of a sudden they are consulting with 100, 10, 20 doctors across the country. So the telemedicine clinic are walk-in clinics. They can be mobile, they can be in fixed location, and we're very flexible in terms of how we deploy them.
Yeah, you're actually in a space where, I mean, your success will be defined by the partnerships, how strong your partnerships are, right? Whether you're talking about government and regulations, and most importantly, funding if you want to grow and grow successfully. So I want you to tell us about the different partnerships and how those partnerships have helped what you're doing. I also would want you to touch about the grants that you have, your partnership with Afrexim, and what you also have in pipeline that you would be more than willing to share.
Well, I think our success has been possible. First, thanks to God who has made it possible for us to get here. And he's the one who gave the vision, and he's the one who is propelling the vision and giving us the right people to support us. So right people, right institution. From very early on, we started to get a lot of support and validation from institutions like the Gates Foundation, as mentioned. They gave us $200,000 grant. We were able to demonstrate the pilot study that showed that our solution was not just useful to the rich and the middle class, but that those who are disenfranchised in the rural communities can also get some benefit from the use of telemedicine. And then we also got some grant from Sanofi at some point, Sanofi Pharmaceuticals, a small grant, which we used again for providing some community outreaches and screening for people in the community. But the biggest grant has come from USTDA, the United States Trade and Development Agency, which gave us $1 million. I think is one of the largest on the continent, and to a female-led enterprise. As you know, Mobihealth is led by is one of the female founded enterprises. And I'll come to how difficult it is for us women.
Sorry, which female are you referring to? Is it not Dr. Funmi that we are already familiar with? You're making it sound as if there's another female somewhere.
So yeah, it's a female-led.
Led by my humble self.
Okay, led by my humble self. So we got the grant of $1 million, arguably one of the biggest on the continent. And it was very important because we find it 6 times harder to raise funding. You, as a woman, people just doubt your capability. It's about, if I was pitching and a man was pitching, they'll be looking at the opportunities that the man is projecting. But the investor will be looking at me from the perspective of will this business fail? Can you tell me, can you prove to me that this will not fail? And your numbers, So we have a lot of barriers, whether it is cultural barriers, biases that we face as women. So the USCDA grant was very, very instrumental in getting us to where we are. And we are really thankful to AIF, Africa Investment Forum, which spotlighted us to the likes of AIF, of USCDA and other investors. And so that grant, because when you get to a point and for you to scale, you need to be able to demonstrate that your business is viable. And you need institutions like KPMG, PwC, Boston Consulting Group, who can validate that your business model makes sense. Now, those kind of institutions are not institutions that you as a startup can fund feasibility studies with. So that grant enabled us to be able to carry out that feasibility study, because it then provided the funding we needed to fund the feasibility for both Nigeria and other markets that we're looking at expanding into. And with that feasibility study showing that we are bankable, then we can boldly approach investors and raise our next round of funding. So that's one of the significant achievements that we have been able to lead this wonderful organization to achieve. And then we just closed a $1.5 million facility with the Afrexim Bank, and that was just announced this week. Again, another incredible achievement for myself and my team and our board of advisors and management and partners.
A round of applause for you.
And that's the project preparation facility also to just support our Pan-African expansion plan. Interestingly, it's one of the many funding that would then come through this partnership and institutional support that we have. It would help us to, again, all our implementation strategies from the BCG report are going to be achieved through that. And with this partnership, we are going to be able to unlock more funding and investment in equity and debt. Already we're getting a lot of interest since this has happened from PEs and VCs who are interested in joining the funding team. We have interest from likes of US Exim Bank to provide funding also for our US import component of our transactions. So it's exciting, but it's also scary, because then that means that all eyes are on us to deliver. So the work has only just started. But I'm excited about it because it's a very, very, the most important part of it for me is that for every telemedicine unit or access that we give, we are saving lives. And it is as simple as just taking your phone or a computer to a local government area, to a school, to a community, and connecting them instantly to medical services. It's as simple as that. It's not about building big, gigantic hospitals. I'm talking about the immediate impact we can make. It's really very, very inspiring. Of course, there will be those who will need hospitalization, 30% who will need to be admitted, who will need to go for procedures. But we want to tackle primary healthcare. We want to tackle that 70% who need instant, immediate intervention, and telemedicine can deliver that quickly. You don't need months, you don't need weeks. It's a matter of minutes that you connect somebody and you can change their lives.
Let's talk about the technology side of your business, right? And one of the reasons why we're having this conversation, because whether you like it or not, Mobihealth is now a tech company.
Yeah,
right?
absolutely.
I mean, you're delivering your service, you're having all those, think about it, you're talking about thousands of doctors globally collaborating with you. You're running your tests with equipment that are dependent on internet and all of that. AI, like you mentioned that earlier, and I really would want you to really talk about the tech side of everything you're doing. How has technology helped, right? And what are you doing in terms of leveraging technology to even achieve more success beyond what you've achieved now?
Okay, so yes, we had pivoted to a health tech company. We're not just a service delivery company. We are a health tech company. Our solution, our business model is B2B, B2C, B2G, but we also provide white label solutions and SaaS model, meaning that we partner with hospitals and other service providers. We can white label our platform so they don't need to invest in tech infrastructure to build. For instance, a hospital can use Mobihealth telemedicine platform. A bridge hospital can become, we have a bridge telemedicine portal powered by Mobihealth. So we provide the technology behind it. We've done that for the Nigerian Air Force. We built the first Nigerian Air Force telemedicine portal for them, and it's the official telemedicine portal of the Nigerian Air Force. So we have that model. So yes, you're right. We're a health tech company. We're not just a service delivery company. Technology is important, of course. It's the backbone of what we do. And it's important that we have the right infrastructure in place. We have the right people with the right skill set. When I started off, it was one of the most challenging part was getting the people with the right skill set to build the platform. We wanted to deploy the technology instantly. We're looking for a solution that was viable, that was cost effective. We couldn't find. Most of the solutions in the market at the time from the US or from Europe were very cost prohibitive. They were based on license fee at foreign exchange rate. At the time, that was even more favorable, but it was still expensive. So you can imagine if we're still paying license fee now. So what we had to do was to build our own platform, and getting the people with the right skill set to build it was difficult. So, but now with COVID, we've seen a lot of increase in the potentials in here. So most of our tech team are also local. So we are creating jobs in terms of job opportunity, employment opportunity for youth, and we're expanding and building a very strong internal tech team. And also the infrastructure that we use is very, very it's important to have the right infrastructure that is scalable, that is secure. So our encryption end-to-end, making sure, because you're dealing with medical data, you want to make sure that you're compliant with the law and that the patient privacy and confidentiality are going to be maintained on your platform. So it's very, very important to have a platform that is robust, that is secure, that is scalable. And that's what our platform delivers. In terms of, what else did you ask? In terms of...
So you've actually touched on what I asked, but I would want to add that you might also want to, explore, I want to believe you're doing that already, but I still will say it anyway, explore, collaborating with some of the tech giants that already have existing, telemedicine solution, telemedicine services that would even drive what you're doing and help leveraging AI for what's it called? Real-time.
So we already have all that built into our model. For instance, chatbot, there are quite a lot of things. We have our research and development in AI. We're already using AI equipment. In terms of data analytics, that's very important as well, because data is very important to make insightful decision, guide policy formulation, guide clinical management, personalized care. So there's a lot of things to do with that. But also in terms of clinical documentation and triage, AI has a role to play there, but you have to contextualize it to the African narrative, and that's what's important. So there's a lot of research that is going on there at the back end. I mean, for partnership, we are always very happy to collaborate where we think that there's synergy and there's strength. We don't need to reinvent the wheel. So we are always collaborating and partnership. We're very big on partnerships, whether it is strategic partnerships for customer acquisition, strategic partnership, like I mentioned, working with pharmacies, hospitals, and even creating new solutions together. So this is what, there's a lot of scope for, in telemedicine and the digital health space for collaboration. So yeah.
Yeah, I'm glad that technology is central to what you're doing, and that already gives me that sense of assurance that what we've seen from Mobihealth so far is just a tip of the iceberg. We will still see a lot more from you. So to wrap up our conversation, and I don't want to sound like one of those investors that would first relate with you on the basis of the fact that you're a woman, and because I personally believe that women are exceptional by virtue of the way you are created and the responsibility that comes with being a mother. So my question right now would be on, balancing the demands, career, personal commitment. I know it's not an easy feat. So as a CEO, maybe the background you already have, excellent academic career could have played a role, but I really still want to know how you balance this.
Well, the honest truth is that it's just been God all the way. It wasn't something that was going to be humanly possible. When I look at my very crazy busy schedule and how our success so far, I can only ascribe that to God and the very strong people that have surrounded me. It's very important for entrepreneurs and founders to be surrounded by the right people, because there will be very dark days, and you need to have a very strong social and professional network of people who believe in you, who will support you. There will be naysayers, those who don't trust, those who don't believe, who don't even think you can go far. And so it's also important to be able to balance that with the support that you get from people who trust, who believe, who have faith in you, who hold your back, who will speak about you behind closed doors and promote your vision. And I think I've been very, very fortunate to have such people in my space. I have a very great team as well, who have always supported me. So I'm the face of Mobihealth, but there are people behind the scene who must take credit for most of the work that we do, because I don't know everything. So there are people who have to live with me and have to help to drive the vision. So yeah, we're incredibly grateful for that. I think in terms of balancing, I'm a mother of 2 and I have a dog. That makes 3. So because a dog is like a child. So I've been fortunate to have very beautiful, wonderful, adorable children who are also taking who are my greatest cheerleaders and inspiration. They're very well-behaved children, so thankfully I don't have to struggle with that. But yeah, balancing is just about prioritizing and also making sure that you, as much as possible, get enough rest. I'm emphasizing that. I'm preaching to myself. And because you have to make critical decisions, and most of the time, these decisions, they come to you and you have to make them fast. Sometimes you have to just take a back seat and just wait for things to evolve. So I've learned a lot from being founder and CEO, and I'm still learning. I have coaches, I have mentors. So those are very, very fundamental to my stability.
I'm a young woman. I just finished my SS3 and I had one of the best results in JAM. I'm considering to study medicine. I'm listening to you right now and I'm so inspired. Like I also want to be a successful entrepreneur like you. What would be your advice to me?
I'll say, well, you can do it and believe in yourself. Don't let anyone talk you out of your vision and your passion. Ensure that your passion aligns with your purpose in life, because that is very important in sustaining you through the entrepreneurial journey. It's not a walk in the park. Entrepreneurship is not a walk in the park. It's not an easy walk in the park, but it is rewarding as much as it is challenging. And I believe that when you look at it from the perspective of the impact that your solution will make in the world, I think that should give you some comfort that you are doing the right thing. So my advice to any young person is to believe in themselves and to surround themselves with the right people to help to propel the vision.
That's a good one. I would surely follow your advice. Finally, this is the final one, just to wrap up our conversation. Telemedicine is rapidly evolving. We've talked about it from the beginning of this session, right? And it has obvious potential to transform healthcare, not just only in Nigeria, but across the entire African continent. Okay, so what are your thoughts on the future of telemedicine for Africa, right? And you might also want to look at it globally. And how do you envision the healthcare landscape in Africa evolving over the next decade? You know, especially with the advancement of digital health, AI, right? I would also want to argue that as good as AI can be, it also could be a major issue, right? You know, look at what people can do with ChatGPT today. A lot of self-medication. Before ChatGPT, you're doing that, of course, on Google. Now with ChatGPT, you probably like, you know, getting consultation without even engaging a doctor directly. You know, and if you look at a country and a continent like Africa, that access to prescription drugs can happen just anyhow. What does the future look like for us?
Well, I think technology will continue to play a pivotal role in the in global health discourse. It's here to stay. As you have mentioned, it's going to be a double-edged sword. It has a potential for good and a very big potential for evil or bad, and that's why we must proceed with caution. Technology cannot replace doctors. It cannot replace human interaction. It's supposed to be an enabler in itself. So I think that we're going to see more uptake and more technologically driven solutions come to the market, but with the inputs and interactions and synergy with doctors and healthcare professionals around the world. For Africa, I think we're going to begin to see more willingness to adopt telemedicine, especially with the government's stance right now. There's now a digital health committee that's been set up by the Federal Ministry of Health, and I think it's been led by very knowledgeable, experienced people. So I want to say that maybe in the next 5-10 years, we're going to see telemedicine both in Nigeria, Africa, and globally become the default. It becomes telemedicine will no longer be just telemedicine, it will become the medicine, because 60%, before you even go to the hospital, it will be your default place to first go. It happened in the UK during COVID. 2/3 of consultations were moved online. You couldn't just go and say you want to go for a physical consultation. So it will become the default in terms of your access, because it's convenient, it's cheaper, it saves you productive time. You don't waste 2 hours going to the hospital to go and wait for 2 hours to see a doctor, and then the waste of time and energy and money is a fraction of the cost as well. So it will become the default when it comes to how quickly you can access doctors. And then it's after that, if you need further evaluation, then you can go to the hospital. So I think we'll continue to see upward trend in the adoption of telemedicine and digital health tools like the wearables that measures your Fitbits, measuring your heart, your everything can now be transmitted to the doctor remotely. All these are going to enhance adoption of digital health and telemedicine. Of course, that will come with the need for a very cohesive digital health policy to protect public health and safety. Telemedicine and digital health tools will also be useful in preventative medicine. We're not talking about just curative. We don't want to wait until we are sick. How can we use telemedicine and digital health to drive preventative medicine so that people become more conscious of their health and that we can then achieve the desired end goals? So upward trend in adoption. There's still a lot of work to be done when it comes to even contextualizing the AI component of it and making sure that it is delivered in the most ethical and safe way. And that has to do again with how we deploy these solutions, it's going to be a multidisciplinary approach between the academia, and the industry. There needs to be some sort of marriage between the two that enables us to develop solutions that are right for this environment and that are secure for the public safety.
What would be success for Mobihealth, success for Dr. Funmi? I mean, your definition of success. When, at what point are you going to say that, yes, finally, we've made it happen?
I wish I could say that, but I think success for us would be when we become the preferred telemedicine provider in Nigeria and across the continent. Because we take very seriously our patient feedback, we want to develop solutions that are user-friendly, that are secure, that are accessible, and we want to be able to impact lives and change lives. So by the time we see that our solutions are driving down the ugly statistics that we have right now in terms of the maternal morbidity and mortality, infant morbidity and mortality across the continent, NCDs, and we're seeing the impact of telemedicine being able to improve access to care for the vulnerable communities, that to me is success.
Wow. I'm with you on this journey. Dr. Funmi, now you have a full supporting you as much as I can, right?
Thank you.
And I'm looking forward to, the next round of success we'll be celebrating about you. I really want to sincerely appreciate your sacrifice, right? Making that decision. I know how tough it can be. I know how challenging the decision of, putting down every other thing and committing yourself to humanity. This is, sincerely appreciated, and I want to thank you very sincerely, on what you're doing. And in any way I can, I will continue to support you. Just to see some of those things that we've identified and talked about. Are we talking about the mortality rates? So many issues. People die for avoidable reasons. So many things that needs to be done in the space of regulation. With voices like you, people like you in practice, I'm sure we really can turn things around. Thank you for your service, and thank you for accepting to be part of the Tech Talk with AFO session. And truly, you are really a tech actor worthy of celebration. Thank you
for
your time.